What is quality management? A broad term which encompasses both quality assurance and quality improvement, describing a program of evaluating the quality of care using a variety of methodologies and techniques. Need for quality management in diagnostic imaging. Diagnostic imaging is a multi-step process by which information concerning patient anatomy and physiology is gathered and displayed with the use of modern technologies. Second, there are various sources of variability in both human factor and equipment factor that can produce sub-quality if not properly controlled. Sub-quality images can result in decreased accuracy of images interpretation, repeat exposure that increase patient dose, increase department cost. Next, this in turn can result in first decreased customer satisfaction and second, which is very important, lost business and revenue. The purpose of a quality management program to control or minimize the error in the following variable as much as possible, and the points are equipments, image receptors, processing, viewing condition, competency of the technologist, support staff and interpreter. Levels of quality of patient care and diagnostic images. First, expected quality, the level expected by the customers. This may be influenced by the outsider factor such as what he has heard from the others. Imaging professionals have least impact on this. Second, perceived quality, the customer's perceptions of the product or service. It is highly subjective how well the imaging professional perform his respective responsibilities will have the greatest impact on this. Third, actual quality. This is the level of quality just by using statistical data and all factors that can influence the first quality of the images, second accuracy of the diagnosis, third timeliness of report to the physician. Next, quality assurance. What is quality assurance? Quality assurance is an all-encompassing management program used to ensure excellence in healthcare through the systematic collection and evaluation of data. Second, the primary objective in the enhancement of patient care, which include first patient selection parameter and scheduling, second management techniques, third departmental policies and procedures, technical efficiency and effectiveness, last in service educations. The main emphasis is on the human factor that can lead to variation in quality care. What is quality control? Quality control is a part of quality assurance program that deal with technique used in the monitoring and maintenance of the technical element of the system that affect the quality of the images. It deal with instrumentation and equipment. A quality control program includes three levels of testing. First, non-invasive and simple can be performed by any technologist. Second, non-invasive and complex require a technologist especially trained in quality and control procedures. Third, invasive and complex involves some disassembly of the equipment and are performed by engineers or physicists. And now the types of quality control test. First, acceptance testing is performed on new equipments or equipment that has undergone major repairs. First, to demonstrate that it is performing within the manufacturer specifications and criteria. Second, to detect any defect that may exist. Third, to establish the baseline performance that may be used as reference point to future testing. Second, routine performance evaluations are specific tests performed on the equipment in use after a certain period of time to verify that the equipment is performing within the previous acceptance standards. Second, to diagnose any changes in performance before becoming radiographic apparent. Error correction test. This is the third test. The error correction test performed on malfunctioning equipments to evaluate the equipments to verify the correct cause of the malfunction so that proper repair can be made. Quality assessment refer to the measurement of the level of the quality at some point in time with no effort to change or improve the level of care. Now the quality assurance test. The routine quality assurance tests are necessary to ensure that the functional performance of the equipment is similar to its baseline value and within the tolerance value as specified by regulatory body. These tests should be performed by qualified service engineers at user institutions. These tests should be performed at regular interval and at major repair of X-ray equipment. There are many types of tests. Quality assurance tests for diagnostic X-ray equipment. There are many types, around 11. Now first is congruence of radiation and optical field, central beam alignment, effective focal spot size measurement, accuracy of operating potential, accuracy of irradiation time, total filtration, linearity of MA/MES loading station, constancy of radiation output, fluoroscopic imaging quality parameters, exposure rate at tabletop, radiation leakage through tube housing. These are the various tests which performed by performed by engineers, but there are few tests which can be done by technologists also. The first is congruence of radiation and optical field. We discuss about this only. Due to shortage of time, I only discuss this topic. The first is the X-ray field must be aligned with the light field so that the operator can accurately position the body part of to be imaging. If not congruent, the area of clinical interest may be missed in the radiograph, leading to retakes and unnecessary radiation exposure to patient. Tolerance, in every machine there is a tolerance, it is also tolerance of A and 2, matlab 1 or 2. Now we discuss the diagram also. What are the tools for this performance? Fiberglass board of area 24 cm into 27 cm in the diagram, which a rectangular area of 16 cm into 20 cm. This rectangle is divided into 4 equal segments by 2 perpendicular bisectors, which are graduated in centimeters. The cassette, the size of the cassette is 10 into 8 inches, distance 100 centimeter. Procedure, how to perform this test? First, check with the help of spirit level that the top of the X-ray is horizontal. Place the cassette on the film, the center of the table. Place the collimator test tool on the cassette. Collimate the X-ray beam on the rectangular area, expose is made and film is processed. Interpretation. From the shift between edge of the optical and radiation field tolerance is 2%. Tolerance is 2%, but we have to check the optical edge and radiation field. Record the differences dimension of optical and radiation field. Record the difference between the sum of length and width of the optical and radiation field. And tolerance is 4%. Result, by confirming the above tolerance limit, we can confirm the congruence of optical and radiation field. Thank you.